The renin-angiotensin-aldosterone system, also known as the RAA system, is one of the most complex and important systems in regulating the body's blood pressure. As the name implies, there are three important hormones in this system: renin, angiotensin, and aldosterone. This system has three functions: 1. To maintain systemic blood pressure and renal blood flow, 2. To maintain the right amount of sodium in the blood, and 3. To maintain the right amount of water in the blood. To make sure these stay at proper levels, several hormones and several organs need to work together. This system is activated when baroreceptors in the carotid sinus sense a drop in systemic blood pressure or blood volume. This can be as a result of excessive diarrhea, vomiting, or perspiration, narrowing of a renal artery, hemorrhage, or dehydration. Juxtaglomerular cells in the kidney are also responsible for sensing low blood pressure or low blood flow. The macular denser cells in the kidney are responsible for monitoring sodium levels in the blood. When there is low sodium levels in the blood, this means that there is low fluid volume as sodium attracts water. Therefore, blood pressure will be decreased because of the lack of water in the blood. When blood volume and blood pressure decrease, the walls of the afferent arterioles are stretched less, and the juxtaglomerular cells secrete an enzyme called renin into the bloodstream. Sympathetic stimulation also directly stimulates release of renin from the juxtaglomerular cells. When renin reaches the liver, it is met by a precursor protein called angiotensinogen, which is synthesized by hepatocytes. Renin becomes the catalyst in a conversion reaction. It does this by clipping off a 10 amino acid peptide called angiotensin 1 from angiotensinogen. This precursor hormone doesn't have any particular known purpose. Angiotensin 1 then passes through the bloodstream to the lungs, where it reacts with another enzyme called angiotensin converting enzyme, or ACE. By clipping off 2 more amino acids, ACE converts angiotensin 1 to an active hormone called angiotensin 2. Angiotensin 2 affects renal physiology in many ways, the first being it's a powerful vasoconstrictive hormone that constricts the afferent arterioles, therefore decreasing the glomerular filtration rate, or GFR. It does this so that the GFR stays normal even in the face of low blood pressure. We need to maintain blood pressure at a certain amount to allow it to properly filter our blood. Angiotensin 2 also causes the release of other hormones. It stimulates the secretion of the water-retaining hormone vasopressin, also known as AVP, in the pituitary gland. Vasopressin prevents the excretion of water without affecting sodium and potassium levels. Angiotensin 2 also signals the adrenal glands to release adrenaline, noradrenaline, and aldosterone. Adrenaline and noradrenaline are released to further enhance vasoconstriction, whereas aldosterone influences the filtration function of the kidneys. Aldosterone is a hormone that stimulates the principal cells in the collecting ducts of the kidneys to reabsorb sodium and chloride. It also secretes potassium and hydrogen into the urine. The consequence is that more water gets reabsorbed from the distal convoluted tubule and collecting duct via osmosis. Aldosterone causes the kidneys to retain sodium, which leads to water retention. With increased water reabsorption by the kidneys, blood volume increases. As blood volume increases, the blood pressure increases to normal. If the renin-angiotensin-aldosterone system is abnormally active, it can be the cause of high blood pressure. So this is a diagram that shows the steps in the RAA system. It starts with renin being released from the kidneys. It shows angiotensinogen being released from the liver, where it reacts with renin to form angiotensin 1. This inactive hormone then meets with ACE in the lungs, where it is converted to an active hormone, angiotensin 2. Angiotensin 2, which is a powerful vasoconstrictor, is also responsible for the release of vasopressin from the pituitary gland, as well as aldosterone from the adrenal cortex. Aldosterone is responsible for the reabsorption of sodium and water, therefore increasing blood volume. The increase in systemic vascular resistance and blood volume helps raise blood pressure. So as we can see, the kidneys play a major role in regulating the body's blood pressure.